Hi, how are you? Mr. Zavala?
Yes, sir.
Pleasure to meet you. My name's student Dr. Leonardo Zayas-Bazan. I'm one of the students here at Barry University for School of Podiatric Medicine. How are you?
I'm doing well, thank you. How are you?
Excellent, excellent. I'm just going to be here to ask you a couple questions. We're going to do a history and physical and see if we can figure out what's going on, okay?
Perfect.
So, just take a seat right here. So, what brings you in today?
Well, doctor, I think I'm having another gout attack on my right foot.
Okay. And you said that was in your right foot, so can you point at it exactly?
Yeah, of course.
Right there. Okay. All right. And how long has the pain been going on?
Since last night.
Since last night.
But I've had gout before.
Oh, you've had gout in the past.
Mm-hmm.
Okay. All right. And what type of pain is it? Would you say sharp, dull, electric, throbbing?
It's a throbbing, sharp pain.
Throbbing, sharp pain. Okay. And does anything make it better?
I've been taking Tylenol, but to be honest, I haven't been taking my allopurinol for several weeks now.
Okay. So you've not been taking your allopurinol. Okay. Does anything make it worse at all?
Well, when you touch it, and mostly during walking.
Mostly during walking. Okay. And does the pain radiate anywhere?
No radiating pain.
No radiating, so it just stays localized there?
Yep.
Okay, so localized. No radiating. Okay. Does it happen during the morning, during the night, or is it constant?
It's constant.
Constant. Okay. And on a scale of 1 to 10, 10 being the worst pain you've ever felt, what would you say?
Probably around a 7.
A 7. That's pretty bad. Okay, so now I'm going to ask you a couple more questions. So we're going to get into your past medical history here. So have you ever been hospitalized before?
Yes, I actually have been hospitalized, but it's been mostly just for surgeries. I had a tonsillectomy,
Okay.
An adenoidectomy,
Okay.
a rhinoplasty for a deviated septum. Let's see what else. I've had a nephrolithotomy, and I also had a removal of basal cell carcinoma on my left cheek.
Wow. Okay. All right. Perfect. You said. Okay. So, do you have any pre-existing illnesses other than gout?
Gout, like you said. I also
Okay.
have kidney stones, hypertension, and depression.
Mm-hmm. Okay. Are you current with your immunizations?
Yes.
Excellent. Do you currently take any medications?
Like I said, I take the Tylenol. I'm also on fluoxetine, Flomax,
Okay.
atenolol. I was supposed to be taking allopurinol, but I stopped that. I also have a list of vitamins I take, but I could just give you the list after. That's not a problem.
Okay. And then the list, can you give me the milligrams of each
Yeah.
medication?
Yeah, of
Excellent.
course.
Excellent. Thank you very much for that. Are you allergic to anything?
Actually, yeah. I'm allergic to NSAIDs.
Oh, NSAIDs. Okay. Have you ever had any blood transfusions?
No.
Excellent. Okay. Any history of emotional problems? Like you said depression, but anything else?
No, just depression.
Depression. Okay. So nothing else. Excellent. So now we're going to get into your surgical history, which you already mentioned
Yeah.
all your, okay, no problem. So I'm just going to write that in there.
Okay.
Your family history. Do you have any family history of diabetes, cancer, kidney disease, heart disease, or hypertension?
Well, my mom has hypertension and bipolar disorder. My grandma died actually, when she was 87 from an MI.
Okay.
I never met my dad, so I don't really know anything from that side of my family.
Sorry to hear that. Okay. All right. I think that's everything that we need for family history. Now let's move on to social history, okay? So how are your sleeping habits?
I get about 4 to 6 hours, a night.
Are you sexually active?
Yes.
Okay. Do you smoke cigarettes?
No.
Okay. What type of work do you do?
I'm a FedEx truck driver.
FedEx truck driver. Awesome. Okay. So it's got to be hard with the gout. Yeah, it's gotta hurt. So, do you exercise regularly?
No.
No. Okay. Do you have any pets?
I got 4 dogs.
4 dogs. Awesome. Very cool. Do you drink any alcohol?
No.
No. Socially?
No.
No. Okay. Do you do any illicit substances, including marijuana?
No.
No. Okay. Are you married, single, or divorced?
I've been married for 35 years.
Excellent. Have you recently traveled?
No.
No. And one question I missed here was the diet. What's your diet like?
Doctor, to be honest, man, I only eat fried foods.
Okay.
No vegetables. I just hate vegetables. I just can't do it, man.
Okay. Well, we'll see what we can do, to instruct you on what to eat, what not to eat, to help you out with the gout, okay?
Okay.
All right. So now I'm going to perform a physical exam, okay? And I'm just going to let you know step by step what's going on and the normals and everything, okay? Is that all right?
Yep.
Okay, perfect. So the first part of the exam is going to be the vascular portion of the exam, all right? And if you can just, that's fine right there. So first thing we're going to do is we're going to check the pulses. So we're going to go for the dorsalis pedis, posterior tibial, and the popliteal pulses, okay? So first I'm going to feel here. And you have a 2 out of 4 in the dorsalis pedis. And for the posterior tibial, 2 out of 4. Perfect. I'm going to go for the lateral side on the popliteal. 2 out of 4. And 2 out of 4. Excellent. So now we're going to check for skin turgor and elasticity, okay, to check for any dehydration or anything like this that you may be having, okay? So what we do is we gently pull on the skin and we make sure that it recoils just as so, the way that you have on your skin right here, which is all normal. We're going to check the temperature gradient, so we're going to go from top to bottom to see, how the temperature changes, if it does at all. So you're just going to run your hands all the way through, and you can see that the skin goes from warm to warm, from proximal to distal. And the last thing I'm going to be checking for vascular is going to be your capillary refill time, which will check for any peripheral vascular disease or anything like that, okay? So we want it to be about 3 seconds. So as you can see, 1, 2, 3, perfect. 1, 2, 3. 1, 2, 3. So it's symmetrical bilaterally, it's normal, it's within normal limits. So for the vascular exam, that's good. So let's move on to derm now, okay? And the first thing we're going to be looking for is to see if there's any lesions, ulcerations, severely dry skin, hyperkeratotic skin, any pigmented lesions, or any open wounds. So what I normally do is I run my hands down all the way from proximal to distal, and make sure also on the bottom to feel for any lesions, any macular lesions, anything that I could feel. And right now everything is within normal limits. The skin looks completely normal, except here on the right side, there seems to be some yellowish, whitish, erythematous lesion or a nodule on the right hallux by the first MPJ joints. There's no other area of erythema. There's no interdigital macerations on the right leg. No interdigital macerations on the left leg. The nails look to be within normal limits. They're well groomed. There's no onychomycosis, no fungus, anything like this. So we're gonna see how we can take care of this, okay? Now for the muscular portion of the exam, I'm gonna test your muscle strength, okay? So what I'm gonna do is I'm gonna have you push against me, okay? Upwards, okay? Now push down, okay? To the sides, perfect. And now inward. Excellent. Okay, so muscle strength is symmetrical bilaterally, and it is 5 out of 5. So it's intact. Everything seems fine. One of the other things we're going to go ahead and do here is going to be something called the silver skylight test. And we're going to go ahead and put your foot in a subtalar neutral position here. Okay, and then we're going to dorsiflex, okay? So we're going to see if we can get that. Okay, should be fine. And then here, I'm going to go ahead and do that again. Okay, right about there. And we're going to dorsiflex. Okay. And that should be within normal limits. I don't see any sort of gastrocsoleus equinus problems or any sort of pathology there. The next portion of the exam is going to be the neurological portion of the exam. And the first thing that we're going to do, okay, is if I can have you slide back just a little bit more. All right, perfect. So we're going to do something called the Sims-Weinstein exam, okay? And that's to check your protective threshold. So just to make sure you don't get any ulcers and things like this, okay? So I'm going to have you close your eyes and let me know when you feel the sensation, okay? And just to let you know this is how it feels, okay? So here we go. You ready?
Yep.
Okay.
Yes. Yes. Yes.
Okay.
Yes. 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 Yes.
Perfect. Okay.
Yes. 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 Yes.
Perfect. Okay. So the protective threshold is intact bilaterally. And the next thing that we are going to do is going to be the proprioception part of the exam. So what I'm going to ask you to do is I'm also going to ask you to close your eyes, and I'm going to move your toes, okay? I'm going to wiggle them, and you're going to let me know if it stays up or if it stays down, okay?
Okay.
So, you ready?
Yep.
Okay.
Up.
Okay.
Down. Down.
Perfect.
Up.
Okay.
Down. Down.
Perfect. So the proprioception is intact, symmetrical bilaterally, so that's within normal limits. Next, we are going to do the reflexes, okay? So we're going to test your reflexes. You're going to do the Achilles reflex and your patellar reflex, okay? Let's go ahead and test your patellar reflex first. Okay? So, okay. Perfect. And now here, I'm going to place my hand below so that I can feel any movement. Perfect. It's my hand below here. Let me do one more time. Perfect. Okay. Now, the reflexes are 2 out of 5, bilaterally, symmetrical, and they are intact. Next is going to be the sensation of sharp and dull, okay? And we're going to go ahead and test out to do, this would be as dull, and this is going to be the sharp sensation, okay? So you're going to close your eyes, you're going to let me know when you feel it, okay?
Sharp.
Okay.
Dull.
Okay.
Sharp. Dull.
Perfect.
Sharp.
Okay.
Dull. Sharp.
Okay.
Dull.
Perfect. So the sharp and dull sensation is also symmetrical and within normal limits bilaterally. And next we're going to do something called the Babinski reflex, okay? And that's to check for any upper motor neuron lesions. So I'm going to have you just roll back a little bit right over here so that I can go ahead and test that, alrighty? So we're going to go from medial to lateral. Okay. Perfect. Now, if it was a positive Babinski, you would see splaying of the toes, and you would see dorsiflexion of the hallux on both sides if there was anything going on right here. I didn't see anything. I saw some plantar flexion, which is normal, so everything is within normal limits. So that is pretty much the entirety of the physical exam and the history, so I'm just going to go ahead and review the results with the attending, and we'll see what we can do to get that gout taken care of, okay?
Thank you.
Thank you. Appreciate it.
Thank you.